Language variant FTD, or primary progressive aphasia. After behavioral variant FTD, the next most common type of FTD affects speech and language. This subtype is language variant FTD, but is also called primary progressive aphasia, or PPA. First, let's define aphasia. Aphasia is when someone has problems expressing language through talking, writing, or signing, and understanding language through listening or reading. The most common cause of aphasia is a stroke that damaged the parts of the brain most supportive of speech and language abilities. However, if a neurodegenerative disease like FTD causes cells within those same parts of the brain to die, a person will have aphasia. When aphasia is the first and most noticeable symptom of dementia, then we call it primary progressive aphasia. FTD is just one of the types of dementia that can cause PPA. When aphasia happens because of stroke, the person with aphasia will usually be able to recover some or most of the speech-language abilities over time. But when it is caused by FTD, the aphasia will gradually worsen over time. There are three types of PPA: semantic variant PPA, non-fluent variant PPA, and logopenic variant PPA. If someone with FTD has PPA, they are most likely to have the semantic variant PPA, but they can also have the other variants. Importantly, people with PPA will often benefit from speech-language therapy. Speech-language pathologists, or SLPs, can help improve a person's ability to communicate by helping to use remaining language abilities, restore language abilities as much as possible, and learn other ways of communicating, such as gestures, pictures, or use of electronic devices. The SLP can also help the person with PPA and their loved ones prepare for what is ahead. As the dementia progresses, the speech-language problems will get worse, and the person will also begin to experience other problems with cognition or mobility or other skills. Eventually, people with PPA may become nonverbal. SLPs can help plan for future language loss by introducing augmentative alternative communication, or AAC, and voice and story banking. AAC includes a wide variety of strategies and technologies that can help a person communicate more effectively. These can include something as simple as a communication advocacy card or a communication notebook that someone can keep in their pocket, or something more complex, like a speech-generating device that says things when buttons are pressed. Voice banking includes a patient recording messages or scripts that they can play back later after their speech abilities have declined. Some programs will allow a patient to synthesize their own voice so that their speech-generating devices sound like them. The SLP can also use this recording opportunity to help the patient record some of their important life stories, characteristic sayings, or any messages that they want to share with their families. PPA tends to progress relatively slowly compared to other dementias, so people with PPA have time to benefit from behavioral treatments and compensatory techniques to maintain communication and to plan for future decline. In summary, language variant FTD, or primary progressive aphasia (PPA), is the second most common type of FTD. It is characterized by early symptoms of language problems, which could involve problems speaking, listening and understanding, reading, and/or writing. It poses significant challenges due to its impact on work, career, and relationships. Treatment and compensatory strategy development can be very helpful for people with PPA.